As the health care reform debate continues on Capitol Hill, there is another effort going on to insure millions of uninsured children. And joining us now via satellite from Chicago is Kathleen Sebelius, the Secretary of Health and Human Services. Secretary, thank you so much for being with us this morning. We really appreciate it.
Glad to be with you, Mike.
Well, you're attending the National Children's Health Insurance Summit to kick off the initiative. What is that all about, and do you think it can push your efforts forward?
Well, absolutely. I know that while Congress is busily debating health insurance reform on Capitol Hill, we want to remind parents across the country and in the great state of New Mexico that their kids may be eligible right now. The President signed into law an expanded version of the Children's Health Insurance Program. In New Mexico, if a family is earning less than $42,000, there is likely to be free or very low-cost insurance available for kids. They don't have to wait for health reform to pass. So the conference today is bringing together advocates from around the country. First time in a decade that children's advocates have come together, and the goal is to reach out to parents to tell them that signing their kids up for Medicaid or children's health insurance is available right now, and we want to make sure that children become the building block of a fully insured America. We've got a great website at insurekidsnow.gov, and parents can go on the website, find out where in New Mexico to sign up, and if they and their family are eligible for this great health insurance plan.
And of course, with the H1N1 virus, we've been hearing a lot about children and health care. And there's some frustration out there right now continuing to be about the lack of the H1N1 vaccine being available. Are you getting the vaccine where it needs right now? Where does that stand?
Well, Mike, as of yesterday, we have about 32 million doses of vaccine that have been distributed around the country. We're delivering to states on an overnight basis. States are ordering. So your Governor, Bill Richardson, and his local health team has identified places throughout the state of New Mexico that are the best possible sites for the priority populations of pregnant women, children, 6 months to 24 years, particularly kids with underlying health conditions. We're getting the vaccine out the door as soon as it comes off the production line. We have fewer doses right now than we'd hope to have by early November, but the gap is closing. There will be enough vaccine, but right now we want to get people in the high priority categories to get to the front of the line. Going to flu.gov, a website where folks can click in the state of New Mexico, find out exactly where vaccination is going to be available, when it's going to happen, will help reduce the phone calls to your hospitals and healthcare providers, and hopefully reduce the time people have to stand in line.
A very busy secretary visiting with us this morning. We really appreciate it, Kathleen Sebelius. Thank you.
Sure. Nice to be with you.